Look at one clinic for Bayelsa State called Eldona Clinic. The kind demonic activity, the kind diabolic activities where they go inside that hospital. Listen to this video.
At first glance, it looks like any ordinary neighborhood clinic, nested off Stadium Road in the Elekahia Road of Purakot, River State. Eldona Clinic presents the image of a routine healthcare facility serving residents of the metropolis. But according to investigators, what allegedly has been going on behind these walls is far from ordinary. On June 12, 2026, operatives of the Force Intelligence Department Special Tactical Squad stormed the facility following what police say is actionable intelligence.
And people have equally complained because some mothers complain that they are not sure that their baby actually died. So that will give us the directions, and then we send some undercover and we confirm it. So once we confirm it, we send our operator to the hospital. That's where they were now.
I work there as an auxiliary nurse, and I'm not yet gone for professional exam yet.
How long have you been practicing?
I'm practicing for about 21 years.
Which of the nursing? At least you went to one of...
In the private clinic.
Okay, let me understand it. You were never trained. You never went to a nursing school.
Yes, but we trained under a hospital. She trained us. You know, it's my boss, I don't know. When he come back with paper like this, I will believe that maybe what she said is true. I did not know about from something like this that happened.
Among the suspects is the hospital's chief medical director, 66-year-old Dr. Elizabeth Obot. The police said that live babies delivered at the hospital were secretly taken away and trafficked, while some mothers were allegedly told that their newborns had died during childbirth, but eventually sold for a certain amount. The investigation took an even more startling turn with the discovery of a dead child allegedly recovered from the doctor's office. Police say the infant's body had been embalmed to preserve it. The police say the dead baby was presented to mothers as their dead baby. In some cases, the dead baby was allegedly rented to other trafficking networks or to any woman who may want to use the dead child to deceive her family.
In 2020, I think one of those women that had issues with the police came and said, if I have a dead baby, and at that time, that day, I had one. So I told her, and she collected it, gave me 10,000 naira. That was it. So the person that wants to buy the child, I can tell the person 3 million. If the person pays the 3 million, then the social mother will get her 2.5 million and go. Then the money on top is what I use for logistics. That dead child was actually a product of miscarriage. The husband was not around. So when we called the husband that this is what happened and that we need to dispose of the baby, we called him and he said, okay, that we can dispose of that baby. I charged him money. He paid the money. But somehow I didn't dispose of that baby. The intention was to use it for a failed cryptic deal. The failed deal is this, that women with fake pregnancies. There are women who have fake pregnancies and may have given the relations, the husband and everything, a date. Maybe they said, I will deliver by May. And when it came to May, nothing happens. When the pressure is too much, sometimes the relations are like, how can you be carrying pregnancy for 12 months, 13 months? They are still telling us they're pregnant. When the pressure is too much, now, whoever is taking care might say, okay, let's end it. Now, instead of letting your husband or your relations know that it was not pregnancy in the first place, you now said, okay, the lady has delivered, but the child died.
How many have you sold so far?
It's not more than 10.
Dr. Elizabeth Obot denies wrongdoing, insisting that she has only been helping desperate families seeking children, and that women who came there voluntarily sold their babies, after which she hands them over to a certain woman who claims to be a social welfare officer.
I would have known that, okay, I don't have license in the first place to do what I do. At the same time, when a woman has been married for 10, 15 years and does not have any child, sometimes they have gone through IVF many times and it doesn't work and they decide to adopt. If peradventure they are able to get one, the family will be very happy and settled. And I will be happy to and settle that at least one family has been settled. But the way it is now, it is illegal.
So how
Maybe
do you feel?
I'm really feeling bad.
Why are you feeling bad?
Feeling bad in the sense that, number one, I should have followed up that lady when she told me that she's from a social welfare organization. I should have followed up to know whether that social welfare is properly registered with the government instead of just dealing with a particular person. So that makes me feel very, very bad.
In recent years, stories of disputed paternity, unexpected DNA results and questions surrounding biological parentage have increasingly surfaced. Investigators believe cases such as these, if proven in court, could help explain some of the unresolved DNA controversies that have shaken homes and marriages.
Those who were confined that they have a stillbirth should come forward so that investigation will commence. We are working on how to arrest other gang leaders because it's a chain of syndicates. So they should come forward. And two, whenever you want to deliver, ensure that your person is right there with you, even in your labor room. And if you want to deliver, because investigation will have confirmed, if you use some other child trafficker, anywhere they have a window that doesn't have protectors, please run away from that hospital because at times they normally take those babies out from the window, especially those two who have undergone CS.
The Special Tactical Squad of the Force Intelligence Department is calling on anyone who has ever received treatment or given birth at Eldona Clinic in Port Harcourt to come forward and report any suspected child trafficking, baby swapping incidents, or any criminal activities they may have witnessed while using the facility.
For families or patients who may have passed through Eldona Hospital, this arrest could mark the beginning of a painful search for answers. For investigators, it is now a race against time to trace missing children and uncover the full extent of the alleged operation. And for many Nigerians, this case may serve as a sobering reminder that the truth behind some long-standing family miseries can be far more complex than anyone ever imagined. The encouraging development, however, is that the Nigeria Police says investigations are ongoing with more arrests expected as efforts intensify to identify victims, recover trafficked children, and reunite them with their biological parents.